Next, let's talk in more depth about the Category A biological agents. As mentioned earlier, the Category A biological agents are what the Centers for Disease Control and Prevention deems the highest priority category because of the significance of morbidity, mortality, relative ease of transmission, and major public health impact. So in the next few slides, we'll go agent by agent within the Category A agent category. And we'll describe on each of these slides, respectively, the incubation period, certain types of clinical presentations, acute and chronic, as the case may be, and distinguish between these different agents accordingly. The first Category A agent that we'll discuss is anthrax. And as I mentioned earlier in this presentation, in the wake of the September 11th, 2001 attacks in the United States, there were a series of anthrax mailings that caused illness and death in several instances. And it's important, therefore, to understand the characteristics of anthrax. Now, there are different types of anthrax. There's gastrointestinal anthrax that affects the GI tract. There's cutaneous anthrax that affects the skin. What we're most concerned about, though, when we think about anthrax in a bioweapons perspective, is inhalational anthrax. And that was the anthrax modality that we saw in the Amerithrax attacks. Typically, the incubation period for anthrax is 1 to 7 days. So notice the range, and that's important to keep in mind for preparedness. The type of infection is very relevant for any of the Category A agent, or any agent for that matter. And with anthrax, we see no person-to-person transmission, and that's important because it affects the epidemiologic characteristics of an outbreak. It's a very different epidemiologic presentation in populations when something is person-to-person transmissible versus when it's not. So anthrax, importantly, is not person-to-person transmissible. As mentioned a moment ago, inhalational anthrax is the most serious and concerning type of anthrax-related infection, and it is the most likely presentation in an aerosolized attack. And as we saw in the Amerithrax attacks, inhalation of anthrax spores are particularly what we're concerned about in such an event. For treatment, we have antibiotics at our disposal, primarily ciprofloxacin and doxycycline. Now, I just want to highlight on the slide here that, as you'll see in boxes, there are acute health effects and chronic health effects. One thing I want to say from the start, as we go through each of these Category A agents, is the initial health effects for virtually all of the Category A biological agents look like the flu. That is a very big challenge for clinical recognition, because how do we know if something is garden variety flu versus what we call a prodromal or early health effect of one of these Category A biological agents? Well, there are some clues that we can use at our disposal. One is, for example, unusual cluster of clinical presentations in a non-endemic area, as mentioned earlier. But I just want to highlight that because, again, in addition to the incubation period, which is a challenge in itself, the initial symptoms look like very generic garden variety flu in most instances. However, once symptoms really kick in for the respective agents, there are distinctive clinical presentations. So acute health effects, for example, of anthrax include everything from acute respiratory distress syndrome, hemorrhagic, meaning bleeding in the mediastinum, which is in the chest cavity. You can have basically fluid in the lungs and in the sac around the heart, and sepsis, which is infection of the bloodstream. There are chronic health effects also that are important to consider when we think about anthrax. And just from this list, I'll just highlight a few. One is joint swelling and pain has been observed chronically, fatigue and memory problems as well. And of course, as for all of these Category A agents, we always have to think about the psychological impacts, not just acutely, but longer term in people who've been affected by these agents and their loved ones and other parts of their social network. So next, let's talk about another Category A biological agent. Again, Category A biological agents are high priority agents as designated by the CDC. And this is botulism. The more formal name is Clostridium botulinum toxin. And in this case, the incubation period, notice how short it can be. It can be as short as 2 to 8 hours, or it can be days. Again, type of infection is important. Like anthrax, this is not a person-to-person transmissible illness. How do people get infected? Well, it can be foodborne through eating foods that are contaminated with this bacteria or other infection of the GI tract. It can also be inhalational, breathing in the toxin, and that can be accidental in a lab setting or caused by an aerosolized attack. Of note, this is not person-to-person transmissible, and that's important from an epidemiologic standpoint and a public health management standpoint. The treatment for botulism is botulinum antitoxin, which of note is only available and supplied by the CDC, and supportive care. When we say supportive care, the acronym to remember is ABC, which is airway, breathing, and circulation. Let's talk about some acute health effects of botulism as a category A agent. Well, one of the things that's very striking and frightening about botulism is it can cause descending paralysis of nerves, motor nerves and autonomic nerves. It can cause difficulty swallowing accordingly. It can cause muscle weakness, vision issues, double vision, drooping eyelids, and a variety of nervous system related complications, and even respiratory failure. When we think about chronic health effects, there can be long-term health effects from botulism exposure, and these include everything from dizziness and dry mouth and fatigue to long-term psychological distress akin to any chronic health effect from a biological agent exposure. There's a trauma associated with it, a psychological one in addition to a physical one. Let's now talk about plague, and plague's Latin name is Yersinia pestis. You may have likely heard of the bubonic plague, which occurred in the Middle Ages. So there's a long history that we know about plague, but the kind of plague that we're particularly concerned about and that CDC is particularly concerned about with regard to category A agents is pneumonic plague, which means affecting the lungs. So unlike anthrax and botulism, plague is person-to-person transmissible, and that is concerning from a public health management standpoint because we have to factor in the reality that people can transmit plague to one another. There are treatment modalities thankfully available, including antibiotics, primarily streptomycin, also gentamicin and doxycycline. The health effects really are akin to that of pneumonia, but you can see a lot of other critical complications, including hemoptysis, which means coughing up blood, shock, shortness of breath, chest pain, cough, and even respiratory failure. So again, this is a critical agent of concern to the CDC and therefore one of its category A agents. Next, let's talk about smallpox. Smallpox has been eradicated for over 40 years, but smallpox is stored in certain laboratories, specifically 2 known locations in the US, and it's thought also in Russia. And of note, if we were to have a smallpox attack, it would be either caused by an accidental release or a bioterrorism event. There is no naturally occurring smallpox anymore. So in addition, the incubation period for smallpox is longer than what we respectively see for anthrax, botulism. It ranges from a week to 17 days. So that means that I could have been exposed to smallpox a week ago or even up to 17 days ago and not show symptoms until as much as 17 days after exposure. This is a big concern from a recognition standpoint. Smallpox, importantly, is person-to-person transmissible, and that's done through inhalation through droplets or aerosol, and it is contagious after the characteristic smallpox rash appears. Also, smallpox can be transmitted and acquired through fluid or handling of contaminated materials with smallpox on the surface, which we call fomites. Treatment for smallpox includes antivirals. Vaccine is available for smallpox, but it needs to be administered within approximately 72 hours following recognition to be effective. So this is really a challenge, or would be a challenge from a public health recognition and management standpoint. Acute health effects include everything from fevers to muscle aches to the characteristic rash of smallpox and lesions which eventually form pustules. Chronic health effects that have been observed with smallpox include everything from blindness to scarring to disfigurement because of the effects on the skin of these smallpox pustules. Next, let's talk about tularemia, which is another category A biological agent as designated by the CDC. So when we think about the incubation period for tularemia, it can be up to 3 weeks, but typically is in the range of 2 to 5 days. Of note, unlike smallpox, there is no person-to-person transmission of tularemia. That, again, is very important. Whether it's person-to-person transmissible or not, matters greatly from a public health recognition and management standpoint. The kind of tularemia that we would be concerned about is pneumonic, meaning inhalation of contaminated aerosols, most likely presented in an intentional attack, a terrorist attack. Treatment for tularemia would be antibiotics, particularly streptomycin and gentamicin. Now, as with other category A agents that we've discussed so far, there are acute and chronic health effects that need to be considered when we think about tularemia. Everything from acutely pneumonia presentation and high fever, chest pain, difficulty breathing, septic shock, and respiratory failure, to chronic health effects that can include organ damage, brain inflammation, inflammation of the heart, bone marrow effects, hepatitis, which is liver inflammation, and even renal failure. Last but not least among the category A biological agents, let's talk about hemorrhagic fever viruses, an example of which is Ebola. And we have seen outbreaks within the past several years in West Africa of Ebola. And there have been in the United States, for example, cases of Ebola that originated in West Africa and affected people in the United States, including, for example, in 2014. The incubation period for hemorrhagic fever viruses, which is again a family of viruses of which Ebola is just one, can range from 2 to 21 days. It is person-to-person transmissible, and it is spread through inhalation via droplets, and in rare cases, aerosols. The treatment here is supportive care. As mentioned earlier, supportive care, the mnemonic is ABC, airway, breathing, and circulation. Securing the airway, making sure that respiration is supported and that circulation is happening. Antivirals are in development for hemorrhagic fever viruses, and there are some acute and chronic health effects that we'll respectively talk about now. So when we think about acute health effects of hemorrhagic fever viruses, we are thinking of a combination of often very dire health impacts, including clotting and bleeding, and gastrointestinal symptoms, and other significant health effects listed here. Chronic health effects for hemorrhagic fever viruses include everything from headaches to joint and muscle pain to eye and vision problems to fatigue and GI symptoms. So as we've discussed, public health needs to be mindful of the ever-broadening threat of biological agents for national and international health security. Biological agents have particular characteristics, as we've discussed. There are different categories of biological agents in terms of priority from the CDC. And as we've described, the category A agents are the ones of chief concern because of their high morbidity and mortality, their relatively very high potential for transmission, and their societal disruption impact. Accordingly, we'll conclude by describing why this is so important and re-emphasizing it. Again, a biological or bioterrorism attack is the deliberate release of these biological agents, whether it's a virus or bacteria or other agents. It's intentional. It's meant to cause illness or death in people, as well as animals or plants. A bioweapon, as we discussed, consists of a biological agent or a toxin and a delivery system. And unfortunately, as a matter of national and international health security, some of these delivery systems can be quite crude and simple. We call bioweapons attacks a low likelihood but high consequence scenario. But as we face an ever riskier world with an ever broadening array of threats, we have to be acutely mindful of bioweapons threats. As we discussed, category A agents are given the highest priority by CDC because of the factors relating to mortality, transmissibility, and major societal and public health disruption. Importantly, the toll of a biological attack is high on victims, on first responders, and health professionals. And we have to keep in mind that these are very vulnerable population cohorts to bioweapons threats. And critically, we have to consider the mental health impacts of bioweapons attacks. Not only are these events that impact people physically, as described in this presentation, but psychologically. And that's a critical aspect of bioweapons attacks that public health must monitor and address in the short, medium, and longer term. Thank you very much.